I'm Femi Okay.
I'm Malika Bilal, and you're in the stream.
Today, the stigma of HIV/AIDS in the Middle East and North Africa. How are misconceptions of the disease impacting the spread of HIV in the region?
And what are attitudes towards HIV/AIDS like where you live? Share your comments with us through our live YouTube chat or via Twitter.
We're the twin doctors, Dr. J and Dr. I. We're from Chicago, Illinois, and you are in the stream.
In the Middle East and North Africa, the topic of HIV/AIDS is still considered taboo for many people. And because there are so many misconceptions and difficult social issues associated with the disease, building awareness of HIV treatment and prevention is no easy task. In the region, there are about 220,000 people living with HIV/AIDS. That represents less than 0.1% of the population. So although prevalence is low in the MENA region, new HIV infections are going up, as are AIDS-related deaths. And that's contrary to global trends, which are actually going down. So today we're here from people working to address HIV/AIDS in the MENA region.
And joining us to discuss this in Beirut, Nasreen Rizk, an assistant professor at the American University of Beirut Medical Center. In Cairo, Simone Salem, regional director for UNAIDS, the Middle East and North Africa. And in Beirut, Eli Balan. He is director of IM Coalition, the only regional HIV/AIDS advocacy network specifically devoted to the needs of LGBT people in the MENA region. He's also a health consultant with the WHO and UNAIDS. Welcome to the stream, everyone.
So, Doctor.
Hello.
Hello. It's good to have you all. So,
how are you?
Very well, thank you. So, Doctor, when you talk to patients and you deal with patients, normally you're having to deal with medical issues. But when you're talking about HIV and AIDS, there's a whole different level of where they fit into society and culture that you have to deal with as well. Would you mind giving us an example of that?
It's true. Being an HIV physician is very special, because HIV physicians and people living, the needs of people living with HIV, especially in the MENA region, are different and more are different than others. So I find myself providing not only medical care and medical advice to my patients, but I realize as well that the social support is very important. A lot of times I am the only person who's aware of the HIV status of a person. People trust the physician. So they come to us for treatment, and we find ourselves doing a little bit of social support, case management, a little psychiatric support at times. A lot of love is in that relationship, and all of this in an effort to overcome the stigma and isolation that people living with HIV suffer from and have to deal with on a day-to-day basis in the Middle East and North Africa. It's true for everybody living with HIV anywhere in the world, but I think the plight is different and heavier possibly in this part of the world, unfortunately.
So keeping that in mind, I want to bring up this tweet from Nigel, who writes into the stream saying that the success of any HIV treatment program depends on identifying as many people who are HIV positive in the society. And I feel that the health system in the MENA region, the Middle East and North Africa, is not doing enough to ensure that every health facility is able to provide HIV testing. Ili, I want to give this one to you because I want us to delve into what it is like to do as this person on Twitter says, in identifying those who need care with care, keeping in mind that there are stigmas attached to living with the disease.
Well, I think he has a point that when people living with HIV take control of the prevention and of the care that is provided for them, more is happening and better things can happen. We have a saying that we say nothing for us without us. So if you want to do something for people living with HIV, as a person who's been living with HIV for 11 years, you need to involve the people who are really involved and see what they have to say. And the problem is not really just around availability of HIV testing, but it's around the stigma that goes around it. Because HIV is transmitted mostly by sharing of sharp needles or sharp objects by unprotected sex. So it's often stigmatized with these taboos of injecting drugs, of gay sex, or of selling sex, which makes it harder for people who want to come forth for an HIV test, worrying that the result is going to out them out of their certain practices, which most of the time are criminalized. This is why we created something called sanity.org. It's a website that helps people find HIV testing centers near them, and it also tells them how friendly they are and how friendly to LGBT when they come to seek these services.
Ellie, if you don't mind me being a little personal here, this is a very personal conversation. When you tell people that you're HIV positive, when they know your HIV status, how do they react to you?
Well, at first, when this first started happening, it used to make me uncomfortable. It used to put me in awkward situations. It would be harder to make friends or find certain jobs. But with time, once I started owning it and using it as a tool to help others to overcome the stigma, to really get over the discrimination and become more comfortable about seeking treatment and seeking healthcare, it helps people around me feel stronger, feel that they have a voice, that someone is actually asking for what they are thinking of. And this makes me, in turn, stronger and hopeful that people will actually take control of the treatment and work in hand with their governments and with the civil society in order to progress in treatment and in healthcare.
Simone, I want to bring you into the conversation. I'm going to play a little bit of a video. It's an educational video. It's a dramatization of a family in Egypt who are subject to some of the issues that might make HIV infection happen. They're ostracized, first of all, and then they're embraced. Let's start with how did they get there, first of all. I'm going to play a little bit and then we can chat. Simone, that tells a story in just a couple of seconds. HIV infection, then there's a family, and then there's a baby. So much more goes on in that story. How effective do you find videos like this are in helping educate the population? Let's say in Egypt, where you're based, for instance.
I think media is what you gave is a very excellent model, because we believe right now to really try to break the barriers and the taboos around HIV. The best thing is really to get people to relate to whoever they see. So when they see media, when they see videos like this, they understand it's a family problem. It's not just one person. It's a whole family of a mother, of a father, of children, and this really plays on the emotions of people. So they know, first of all, it's not away from them. It's not far. It's not something that they think it happens to other people. It doesn't happen to me. No, it's close, and it can really happen to anybody regardless. So I think media, and this is really what we try to do now more and more, is to try and get champions like these people in the movie, Ahmed Malik, and I'm happy we have also Yusra, our Goodwill Ambassador. We try to get these people whom the audience relate to really bring a message across that HIV is a disease like any other. It's an infection that can come to you. It's treatable. You can live a long life. You can just get treatment. It can be it's a chronic illness, like if you have.
It looks like Simone's connection just dropped, but I want to pick up on the point that she was raising there, that it is a chronic illness, but it is something that is treatable. Of course, only if you know you have it. So look at this tweet here from Neslihan, who's sent into the stream. The young women of childbearing age may suffer the most when it comes to risks involved with being infected by HIV, especially when they fall pregnant, not even knowing that they have HIV. Nasreen, talk to us about this. Those in communities where it is not as easy to admit or to get tested to see if you might be infected.
So it's true that HIV testing is very stigmatized in this part of the world. It is not mandatory in all the countries in this region. In the instance, for example, of for pregnant women. So a lot of times, and as you started by saying, HIV is a chronic disease today. This is an infection that one can acquire early in life or several years, and have no symptoms and go on to live a normal life and have no symptoms for several years, 5, 8, 10 years sometimes. And during this period of time, obviously HIV is doing its job as destroying maybe the immune system slowly, giving no symptoms. And the only way to know is to get the test done. And if someone tests during this period, before they have the signs of an advanced infection, there's a lot we can do anyway at any point of infection with HIV. It's a very treatable disease today. But I just want to emphasize that it's really optimal if we diagnose everyone early, so that treatment is started early. Treatment is prevention. That's what the WHO has always been stressing on. So you treat, you test, we treat, and this way we prevent the immune dysfunction in a person, and we prevent transmission to others around them, whether they're sexual contacts or whether they're children, in the case of pregnant women and women of bearing age. So it might be costly to treat the HIV infection. It's true, but we're lucky that in a lot of countries, those medications, the life-saving medications, are available for everyone who's positive. And there's always a way to get someone who's positive on treatment. So this is the easiest part. I think what we suffer from, especially in the MENA region, is the stigma around testing, and that big wall that people do not want to do the test. People do not want to listen about HIV, because if they ask the questions maybe, or they go to buy the test or go buy condoms, they might be looked at as if they were the bad guy or the bad girl in a certain social context.
Doctor, but it's more than that. It's not just the bad guy or the bad girl. People are thought to be dirty.
Right.
Explain exactly. A little bit more, because it's not the region that I live in, and I don't want to put words in your mouth. Ellie, help me out here.
Well, the thing is that because HIV is often related to certain things that people see as taboo. So when someone has HIV, the first thing that people say is that you're either gay, or you're either selling sex, or you're either using drugs, which is a huge misconception. The bigger problem, I think, than just stigma is actually education. Our region stopped learning about HIV back in the 90s. At first, when it first broke out in the 80s and the 90s, our governments put in systems. They were educating the people because they were very scared of it as something that was going to kill masses of people. And then when treatment started to progress and science started to progress, our community stopped talking about it. So for a lot of the people, they're still stuck in the idea that HIV is AIDS, which are totally different things, and that's something that's going to kill you. HIV is the virus that leads eventually to AIDS. I was in a radio show 2 weeks ago, and a lot of people were talking. It was a religious family show, and I was sharing my story. There were live people calling, and someone called and said, right now I just parked my car and I'm very scared. I don't know what you're talking about, but I want to know more. And then another mother called and she said, I'm really very far from knowing anything about HIV, but I appreciate your honesty because you're helping me know more so I can educate my children. So it's not really just about treatment or about prevention or about testing or about stigma or education. It's about everything together. It's actually a full cascade of different elements that have to be put together in order to proceed and to progress.
Eddie, it's interesting you said that. We just got this comment on YouTube from Lee, who says you have to start with education. And that comes after this exchange here that I want to share. Brian on YouTube writes in, I heard that black seed and honey cures HIV. Can you guys look at the studies that have been done on this? And someone else writes in, also on YouTube, Alex says, no, you need drugs to control it. I wish it was that easy. Simone, talk to us about some of the misconceptions that you hear and help break those myths for us right here.
Well, first of all, I think I'm so happy you brought these two examples about treatment, because people think, if you eat well, if you just take, some kind of immunity medication, you will be okay. You don't need to take the treatment. And this is really, really very harmful for the messages we are trying to pass to the people. You need to take your medication, and it's easy and it's doable, and there's no problem in doing that. The other misconception is that people believe that, for example, some people, although they know very well how HIV is transmitted, they sometimes forget. They say, no, it's okay. I know this person, this relationship. He seems okay. I mean, I can trust this guy, or I can trust this person. I think we need to be careful, and education starts that you need to understand that you don't know where it will come. Nobody is immune. Risky behavior is risky behavior everywhere. Also, some misconceptions, people think, okay, you can get HIV by hugging, by kissing, by sharing a toothbrush. I hate this when people tell me, we can get HIV by sharing a toothbrush. You can get HIV.
Simone, when someone says that to you, what do you tell them?
I tell them this is ridiculous. You have only 3 ways of getting the transmission. We have also sometimes, and I'm so happy we're having this conversation, sometimes you have on the Facebook and YouTube, people drank blood that was contaminated by someone wants to contaminate others into a brand name of a Pepsi or a Coke. These kind of things go around, and it really is ridiculous. You only get infection of HIV if you are exchanging a needle through a drug. Most probably it's through drugs. Our blood transfusion is screened. So basically it's very difficult even in this region to really have HIV through normal blood transfusion, because it's really very well screened in most of the countries of the region. The other is mother-to-child transmission. I'm so sorry to say that most of the cases we know right now, we know them through the children, the babies. They come to the hospital. We don't know what's wrong with them. They do the screening. They realize they are HIV positive. Then they bring the mother. She's HIV positive. They bring the father. And here you have a whole family that's HIV positive. So this is one.
So
another
Simone,
thing.
how does that happen? Because Ellie said again that there was somebody who was listening to the radio show he was on, and there was fear. There was fear in just listening because not understanding. So how does that entire family, in that instance, for example, all end up HIV positive?
It's happening because, first of all, there might be one person in it who has been subjected to any of these things I've been saying. For example, he might be have had sex, unprotected sex, and then, of course, he came home and he had sex with his wife, and then she got pregnant. And this is why we say, if you feel that you have had any one of these behaviors that would get you, to be possibly infected with HIV, you need to do the test. And definitely what we really say is we don't want to really stigmatize people. Tests, like in other regions of the world, you should be normalizing it. We are very close coming into self-testing. Self-testing in this region will change a lot of taboos that we have, because people will be able to do their own test at home. The stigma will be less. There will be so many work done with the community to try and get them referral, support, get the treatment. Because end of the day, really, it's a very simple, HIV is a very simple disease. You have more horrible diseases people should be afraid of. You should be afraid of cancer more than you would be afraid of HIV. Seriously.
Simone, I want to jump in there because I want to share 2 anecdotes from our community. One, highlighting some of the barriers to getting tested. You're saying testing is so important. One of our community members talks about why that is so difficult. This is Mohammed, who is a researcher, Iranian researcher in Vancouver, and here's what he said.
HIV data availability and integrity are poor in MENA. This is mainly due to the lack of political will because of the sociocultural sensitivities around HIV research, persistence of violent conflict across the region, stigmatization and criminalization of key populations at risk of HIV, including people who inject drugs, men who have sex with men, and female sex workers, as well as several countries struggle with financing HIV research.
So I promised you 2 anecdotes. That on the one side is some of the barriers to treatment. Here are some positives. Carol tweets, success stories in controlling HIV and AIDS come mostly from North African countries. That includes Morocco, Egypt, Libya, Algeria, and Somalia. Talk to us, Nasreen, about some of those success stories and what's bringing you hope.
What's bringing me hope is that times are changing and people like Ellie are engaged in the fight, are in the front, up front. What's giving me hope and is the we have to have hope. We just cannot let HIV win the battle. It is true, like Simone was saying, it's a very simple disease. It's easy to treat and it's very preventable at the core. And then once the person is infected and it's diagnosed early, we can start treatment early on, and it becomes like any other chronic infection. What I really want to continue fighting against is the stigma and the fact that a lot of people do not really consider HIV as another disease like any other disease. I really want to, get rid and finish with the stigma because it's preventing so many people, especially in this region, from getting tested, getting the treatment they deserve, and getting the life that they deserve, a long and happy and a healthy life. So I have hope because everybody has faith in the new generation and the young people. I have faith that, a lot of people and like your program today, this show today is bringing shining the light on this issue, that it's easy. There are a lot of success stories in a lot of places in the world. Look at African countries where the number of new infections is decreased by 50%. I mean, who would have thought this was possible in 1984 and 1986? So this is what I'm looking at. This is what I'm looking up for. I'm hoping for a vaccine. I am hoping for a cure. We are all working and all thriving to find a cure and finding a vaccine for HIV. Even though it's a horrible virus, and I hate it very much. Personally, I hate it very much. But I think it's allowed us to look inside us and maybe, like we're doing here, deal with all these issues that are not only medical or scientific, but look at the stigma, look at the basis of the stigma, look at the fact that a lot of people are not knowledgeable. There's a big gap in the knowledge and the education and the health knowledge and health literacy of huge numbers of people, especially in the Middle East, about HIV and other issues.
How do you fix that? Just very briefly.
By educating people and realizing, and I think it's obvious today, that HIV education and HIV prevention has to be at the core of a good health education for all the young generation, especially in the MENA region. I think by doing that, integrating HIV prevention and HIV treatment in the middle of sex education and sexual health is key to providing this young population here that's growing in numbers and that is the target of HIV and other sexually transmitted infections, the weapons and the means to fight them and lead healthy and long lives and enjoy themselves the way they're supposed to, and be happy no matter who they are and their aspirations.
So let me just check back in. Doctor, I've got 1 minute left. I just want to check back in with Ailey to ask him, in the 11 years since you became HIV positive, what's changed for the better, Eli?
Well, I'm glad you asked me that, because while we're talking about education, science has progressed and we have evidence that proves so. So a person living with HIV does a viral load test once a year, which is a test that will actually identify how disseminated the virus is in the body. And when you're taking your treatment and you're taking it regularly every day, that's viral load is suppressed and goes undetectable.
Yes.
So when a person is undetectable because they're virally suppressed, they're not able to transmit the virus or pass it on to anyone else, even if they had unprotected sexual relationships. This is what the whole world is talking about now.
So Eli, I hate to rush you. In a final sentence,
untransmittable.
Wrap it up. Wrap it up in a sentence.
Undetectable is untransmissible. If you're committed to your HIV treatment, you will not pass HIV.
How are you feeling today?
Wonderful.
Great.
Nice to hear that. Malika.
Well, Charbel here writes in for you, Ellie, that the stigma will be broken when there's more people fighting for it like you. I salute your courage and your cause.
Dr. Najeen, Simone, Ellie, thank you so much for being on today's edition of The Stream. We will always be online, but thanks for watching, everybody. See you at AJ Stream on Twitter.